Hello, everyone. We are Group 1, and we are going to be presenting on colonoscopy. My name is Mohsin Kaleem. My fellow group members are Angelina DaCosta, Lee, Sophia Tuason, and Michelle Urmatan. What is a colonoscopy? So, a colonoscopy is a diagnostic and therapeutic procedure where a camera is essentially inserted into the colon and allows for the visualization of the entire colon. The provider can detect any inflammation, polyps, or masses that are present in the colon. In fact, a 2020 review in the New England Journal of Medicine found that colorectal cancer incidence can be decreased by 68% if colonoscopies are performed regularly. So essentially, a gastroenterologist is at the head of the table performing the colonoscopy, and we as nurses are at the heart of the procedure because we're ensuring patient safety, responding to any complications, and managing care before and after. So it's also important to remember that biopsies can also be taken during the procedure through an additional procedure called polypectomy, where the polyps can actually be removed. So as far as the anatomy and physiology goes, a colonoscope is essentially inserted into the anus, and it goes into the rectum, the sigmoid colon, up the descending colon, around the splenic flexure, into the transverse colon, into the hepatic flexure, and then down the semicolon to the cecum. So it's uh, it's a long process that it has to go through to see any polyps and any abnormalities in the colon. But around the splenic flexure and the hepatic flexure, it's important because those are areas where the mucus lining is thin, so they're more prone to perforation from the actual colonoscope. So it's important in those areas to manage any symptoms that abnormalities that can arise, and be aware of any bleeding or any other symptoms.
In terms of pathophysiology, since we're talking about colonoscopy, I'll be going over conditions that indicate the need for one. So, colonoscopies play a key role in identifying various GI conditions. It can be used to detect adenomatous polyps, which are precursors to colorectal cancer. It is also essential in diagnosing IBD, diverticulitis, diverticulosis, and when patients have chronic GI bleeding or iron deficiency, anemia, or unexplained changes in their bowel habits. A colonoscopy can help provide some kind of clarity on any underlying conditions that may be at play, and it is often related to mucosal damage, strictures, or tumors. In respect to pathophysiology, I also want to go over some dysfunctional organs that involve the need for a colonoscopy. So the first thing I want to go over is obviously the colon and the rectum, which are common sites of mucosal inflammation, polyp formation, and malignancy. And when the GI mucosal barrier is impaired, patients can experience bleeding, pain, or poor nutrition absorption. And lastly, a colonoscopy can also help uncover hemostatic dysfunction, which may present as abnormal bleeding during an exam. Now, the next slide is going to look over the signs and symptoms that are involved in this procedure. So, the key symptom of colorectal issues is usually rectal bleeding. It can be either dark or bright red, and that can come along with persistent abdominal pain, unexplained weight loss, and chronic constipation or diarrhea. Patients should also watch out for a sense of incomplete evacuation, fatigue from the anemia, mucus in the stool, bloating, or pencil thin stools, and these changes can indicate inflammation, obstruction, or malignancy, and they warrant further evaluation.
Hi, my name is Michelle, and I will be presenting on labs and diagnostic testing and medications. Colonoscopy is a key procedure for examining the large intestine, and it is used for early detection of colorectal cancer, as well as diagnosing chronic diarrhea, unexplained GI bleeding, and removing polyps. Screening typically starts at age 45 for average risk individuals and repeated every 10 years or sooner if the patient has family or personal history. Preparation is crucial, so patients are placed on a clear liquid diet the day before and use a bowel prep solution, sometimes involving laxatives or enemas. And red, orange, or purple colored drinks and gelatin should be avoided. Certain medications like aspirin, anticoagulants, and antiplatelets should also be paused. And patients with diabetes should consult with their provider to adjust any medications due to being on a nothing by mouth diet before the test. And during the procedure, the provider can take biopsies, remove polyps, and use hemostatic agents if bleeding occurs. So next is medications. And so to keep patients comfortable, moderate sedation is given via IV. And common medications include midazolam, fentanyl, and propofol, with propofol being the most commonly used for moderate sedation. And atropine sulfate may be used if the patient experiences bradycardia, often caused by vasovagal response. And after the procedure, we must monitor vital signs and ensure that the gag reflex has returned before allowing fluids. And this usually takes about 30 to 60 minutes. Patients should also not drive for about 12 to 18 hours due to the lingering sedation, and they may feel gas or cramping from the air or the carbon dioxide that was used during the exam. Finally, it is important to clearly communicate medication adjustments before and after the procedure, especially those on blood thinners and NSAIDs.
For nursing interventions before the procedure, we must provide information about the procedure and make sure the provider obtains the informed consent prior to the procedure. We need to instruct the patient to hold anticoagulant and antiplatelet for several days before the procedure because these medications might increase the bleeding risk. For bowel preparation, we need access for any contraindications like CHF or renal impairment, confirm the patient receives the prep instructions and understands them. Teach patient to maintain NPO status for 6 to 8 hours prior to the procedure. Before the procedure starts, we need to perform a thorough assessment to obtain patient's baseline vitals, review medication history, and check for allergies and their lab results. We need to establish an IV access for sedation or emergency med. During the procedure, we collaborate with the provider to administer the sedation. We help the patient to be in the left lateral position with knee draw up. Then we need to continuously monitor patient's vitals, level of consciousness, and any complications, and make sure the suction and emergency airway equipment are available. Then we should document everything clearly. After the procedure, patients are transferred to the recovery room for monitoring. We need to check vital signs every 15 minutes until they are stable and monitor for any complications. Let patients maintain NPO status until they are fully alert and able to pass flow tests. We can encourage patients to lie on their left side to help release gas and discontinue the IV fluid once they can tolerate the oral intake without nausea. Patient education is also critical here. We can inform patients they may have gas, minor cramping, or small blood. Instruct the patient to report severe pain, heavy bleeding, or fever. We should also let patients know that they shouldn't drive or make legal decisions for the rest of the day due to the sedation effect. For discharge, we should ensure they have a responsible adult to take them home and provide them with written instructions and follow-up information.
Hi, my name is Sophia Tuason, and I will be going over the precautions before and after a colonoscopy. Before a colonoscopy, it's important to go over a patient's medical history, make any proper medication adjustments, ensure proper bowel preparation is performed, going over proper nutritional habits and what to avoid, as discussed earlier, and having transportation set up after the procedure. After the procedure, it's important to monitor for any complications, help reintroduce the diet slowly, help go over the results and findings with the patient and the physician, and go over any proper discharge teaching. While colonoscopies are generally safe, some complications can arise, such as noncompliance with pre-procedural instructions, the perforation of the GI tract, hemorrhaging. Bleeding can occur if a polyp is removed and stops on its own. If it does not, it can be life-threatening. An infection status post-procedure, and as well as abdominal pain. In conclusion, a colonoscopy is a diagnostic procedure done in the GI tract used to screen for colorectal cancer, investigate GI symptoms, detect and remove polyps, and evaluate conditions like irritable bowel disease or diverticulosis. Indications for this procedure are rectal bleeding, unexplained anemia, persistent bowel habit changes, abdominal pain, or a known history of cancer or polyps. It's important to follow pre-procedural instructions from the ordering provider. As nurses, it's important to monitor vital signs, level of consciousness, and any pain before, during, and after the procedure. It's also important to assess for complications such as perforation, confusion, bleeding, and severe pain. Post-procedure education is important on what is to be expected or normal versus concerning symptoms, such, for example, gas is normal, but heavy bleeding is not. It's also important to follow up with your primary doctor for any concerns and the potential need for more frequent screenings. Here are our references. Thank you.